Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease where the immune system attacks the joints, causing inflammation, pain, and swelling, primarily in the hands and feet. Lupus. Lupus is a chronic autoimmune disease that can affect multiple organs, causing symptoms like fatigue, joint pain, and a distinctive butterfly-shaped rash on the face. Multiple sclerosis (MS). Multiple sclerosis is an autoimmune disease that attacks the protective covering of nerve fibers, leading to symptoms like muscle weakness, numbness, and coordination difficulties. Type 1 diabetes. Type 1 diabetes occurs when the immune system destroys insulin-producing cells in the pancreas, requiring lifelong insulin therapy to manage blood sugar levels. Psoriasis. Psoriasis is a skin condition where the immune system triggers rapid skin cell production, leading to thick, red patches covered with silvery scales. Graves' disease. Graves' disease is an autoimmune disorder that causes the thyroid gland to produce too much hormone, leading to symptoms like weight loss and rapid heartbeat. Hashimoto's thyroiditis. Hashimoto's thyroiditis is an autoimmune disorder where the immune system attacks the thyroid gland, causing hypothyroidism with symptoms like fatigue and weight gain. Celiac disease. Celiac disease is an autoimmune condition where gluten ingestion triggers an immune response that damages the small intestine, leading to malabsorption and digestive issues. Sjogren's syndrome. Sjogren's syndrome primarily affects the glands that produce tears and saliva, leading to dry eyes and dry mouth, along with joint pain and fatigue. Ankylosing spondylitis. Ankylosing spondylitis is an inflammatory autoimmune disease that affects the spine and sacroiliac joints, causing pain, stiffness, and potential spinal fusion. Scleroderma. Scleroderma causes the skin and connective tissues to harden and tighten, and can also affect internal organs like the heart and lungs. Myasthenia gravis. Myasthenia gravis disrupts communication between nerves and muscles, leading to muscle weakness, especially in the eyes, face, and throat. Vasculitis. Vasculitis causes inflammation of blood vessels, which can reduce blood flow and damage organs and tissues, with symptoms varying by the affected vessels. Pemphigus. Pemphigus is a rare autoimmune disease causing blistering of the skin and mucous membranes due to the immune system attacking skin proteins. Autoimmune hepatitis. Autoimmune hepatitis is a liver disease where the immune system attacks liver cells, leading to inflammation and potential liver damage. Addison's disease. Addison's disease is an autoimmune condition where the adrenal glands are attacked, leading to insufficient production of cortisol and aldosterone, causing fatigue and low blood pressure. Pernicious anemia. Pernicious anemia is caused by the immune system attacking the stomach lining, leading to vitamin B12 deficiency and symptoms like fatigue and neurological issues. Guillain-Barre syndrome. Guillain-Barre syndrome is a rare disorder where the immune system attacks the peripheral nerves, leading to muscle weakness and possible paralysis. Alopecia areata. Alopecia areata causes the immune system to attack hair follicles, leading to patchy hair loss on the scalp and other parts of the body. Inflammatory bowel disease (IBD). IBD, including Crohn's disease and ulcerative colitis, involves the immune system attacking the gastrointestinal tract, causing symptoms like diarrhea and abdominal pain. Dermatomyositis. Dermatomyositis is an autoimmune disease that causes muscle weakness and a distinctive skin rash, often affecting the face, chest, and hands. Polymyositis. Polymyositis is an autoimmune condition that causes chronic muscle inflammation and weakness, particularly in the shoulders, hips, and thighs. Primary biliary cholangitis (PBC). PBC is an autoimmune disease that slowly destroys the bile ducts in the liver, leading to bile buildup, liver damage, and symptoms like fatigue and itching. Wegener's granulomatosis. Wegener's granulomatosis, also known as granulomatosis with polyangiitis, causes inflammation of blood vessels, particularly in the respiratory tract and kidneys. Bullous pemphigoid. Bullous pemphigoid is an autoimmune skin disorder that causes large, fluid-filled blisters, primarily on areas like the abdomen, upper thighs, and arms. Primary sclerosing cholangitis (PSC). PSC is a chronic autoimmune disease that causes inflammation and scarring of the bile ducts, leading to liver damage and eventual liver failure. Vitiligo. Vitiligo is an autoimmune condition where the immune system attacks the pigment-producing cells in the skin, leading to patches of depigmented skin. Systemic sclerosis. Systemic sclerosis, or systemic scleroderma, is a severe autoimmune disease that causes widespread skin thickening and can affect internal organs. Autoimmune uveitis. Autoimmune uveitis is inflammation of the uvea, the middle layer of the eye, caused by an autoimmune reaction, leading to redness, pain, and vision problems. Autoimmune encephalitis. Autoimmune encephalitis is a rare condition where the immune system attacks the brain, causing inflammation, seizures, and psychiatric symptoms. Behçet's disease. Behçet's disease is a rare autoimmune disorder that causes inflammation in blood vessels throughout the body, leading to symptoms like mouth sores, eye inflammation, skin rashes, and genital sores. Mixed connective tissue disease (MCTD). MCTD is a rare autoimmune disease that features symptoms of several other connective tissue diseases, including lupus, scleroderma, and polymyositis, leading to joint pain, muscle weakness, and Raynaud's phenomenon. Eosinophilic esophagitis (EOE). EOE is an autoimmune condition where the immune system causes inflammation of the esophagus, leading to difficulty swallowing, food impaction, and heartburn. Goodpasture syndrome. Goodpasture syndrome is an autoimmune disease where the immune system attacks the lungs and kidneys, leading to bleeding in the lungs and kidney failure. IgA nephropathy. IgA nephropathy, also known as Buerger's disease, is an autoimmune disease where IgA antibodies build up in the kidneys, causing inflammation and leading to kidney damage. Chronic inflammatory demyelinating polyneuropathy (CIDP). CIDP is a neurological autoimmune disorder where the immune system attacks the myelin sheath covering nerves, leading to muscle weakness, sensory loss, and difficulty walking. Rheumatic fever. Rheumatic fever is an autoimmune reaction to a bacterial infection that can cause inflammation in the heart, joints, skin, and brain, potentially leading to long-term heart damage. Sarcoidosis. Sarcoidosis is an autoimmune disease characterized by the formation of granulomatous small clumps of inflammatory cells in various organs, most commonly the lungs, leading to breathing difficulties and fatigue. Morphea. Morphea is a localized form of scleroderma where the immune system causes hardening and thickening of the skin in specific areas, often leading to skin discoloration and tightness. Immune thrombocytopenic purpura (ITP). ITP is an autoimmune disorder where the immune system mistakenly attacks and destroys platelets, leading to excessive bruising, bleeding, and a higher risk of severe bleeding events. Autoimmune hemolytic anemia (AII). AII occurs when the immune system attacks and destroys red blood cells faster than they can be produced, leading to symptoms like fatigue, dizziness, and shortness of breath. Dermatitis herpetiformis. Dermatitis herpetiformis is a chronic skin condition linked to celiac disease, where the immune system causes itchy, blistering skin rashes, often on the elbows, knees, and buttocks. Autoimmune pancreatitis. Autoimmune pancreatitis is a form of chronic pancreatitis where the immune system attacks the pancreas, leading to inflammation, abdominal pain, and digestive issues. Relapsing polychondritis. Relapsing polychondritis is a rare autoimmune disorder where the immune system attacks the cartilage, leading to pain and inflammation in areas like the ears, nose, and joints. Aicardi-Goutières syndrome. Aicardi-Goutières syndrome is a rare autoimmune disorder that affects the brain, skin, and immune system, leading to neurological problems, developmental delays, and skin lesions. Stiff person syndrome. Stiff person syndrome is a rare autoimmune disorder causing muscle stiffness and spasms, primarily affecting the trunk and limbs, which can lead to significant mobility issues. Takayasu arteritis. Takayasu arteritis is a rare autoimmune disease that causes inflammation of the large blood vessels, particularly the aorta, leading to symptoms such as fatigue, fever, and reduced blood flow. Polyglandular autoimmune syndrome. Polyglandular autoimmune syndrome is a condition where multiple endocrine glands are affected by autoimmune reactions, often leading to a combination of autoimmune diseases like type 1 diabetes and thyroid disorders. Chronic fatigue syndrome (CFS). Chronic fatigue syndrome is a debilitating condition characterized by persistent and unexplained fatigue that doesn't improve with rest and worsens with physical or mental activity, potentially involving autoimmune mechanisms. Sjogren's syndrome. Sjogren's syndrome is a rare autoimmune disorder that affects the eyes and inner ear, causing symptoms like vision loss, hearing problems, and dizziness, often associated with inflammation of blood vessels. Cryoglobulinemia. Cryoglobulinemia is an autoimmune disorder where abnormal proteins in the blood precipitate in the cold, leading to symptoms like joint pain, skin rashes, and kidney issues. Rasmussen's encephalitis. Rasmussen's encephalitis is a rare, chronic inflammatory disease of the brain that causes seizures, motor and cognitive impairments, and is thought to have autoimmune origins. Sjögren-Larsson syndrome. Sjögren-Larsson syndrome is a rare genetic autoimmune disorder characterized by neurological impairment, skin changes, and visual abnormalities caused by mutations affecting fatty acid metabolism. Autoimmune inner ear disease (AID). Autoimmune inner ear disease is a condition where the immune system attacks the inner ear structures, leading to progressive hearing loss and balance issues, often associated with other autoimmune disorders. Autoimmune diseases are complex, but understanding them is the first step toward better management and support. Don't forget to subscribe, share, and hit the notification bell for more insightful content.